infectious disease, including Lyme disease and other insect-borne infections that are common to the Midwest here. From a research perspective, I do a lot of work on antimicrobial resistance and antibiotic misuse, and that'll tie in a little bit to what I talk about in some of my slides. So what I think we're hoping to do here is I'm going to do about a 7 or 8 minute walk through the basics of Lyme disease and some of the what we call epidemiology or pattern of disease. And then talk a little bit about some of the uncontroversial aspects of Lyme disease. And then I'm going to turn it over to Dr. Staudinger and Longo to talk about their clinical experience with dealing with cases in this region. And then I'm going to come back and do another 5 or 7 minutes talking about perhaps some of the more controversial aspects where there's still a lot of uncertainty, and certainly I think there will continue to be some research in this area. So if I could get the first slide advanced. So, no, this doesn't look like my slide. There we go. Very good. Okay, I was about to say that's very unfamiliar. So, so if you could go ahead and advance to the first slide. So, first of all, I just, every time I do a talk, I give a conflicts of interest because I think it's important for people to know where I'm coming from. So I have no financial conflicts of interest. I don't get paid to do these talks, and I don't get paid to talk about Lyme disease. I do have what I consider a bias in that there is two camps as it relates to Lyme disease, and I want you to be aware that I come down on the side that is espoused by the Infectious Disease Society of America and the Centers for Disease Control, and that certainly will color some of my statements and comments here. So if I can have the next slide, please. So when we talk about Lyme disease, the first question that I think is important to ask, well, what is it? Well, it's a bacterial infection. What you can see there on the left side of this slide is what we call a dark field microscopy picture. And those little corkscrew figures that you see there, that's the actual bacteria. It's a spirochete bacteria, that's the term. And then the figure that you see there on the right is just the geographic density of Lyme disease cases. And what you can see very clearly when you look at that figure is that this is concentrating in the northeast portion of the country and clearly in the upper Midwest, smack dab in this state. If you kind of hone in even closer on that figure, you'll see that there are rare reports of cases pretty much in all the states in the U.S., but it's important to note that reporting is occurring where the disease is diagnosed, not necessarily where it was acquired. So many of those patients, say down in Texas, who report having Lyme disease or being diagnosed with Lyme disease, were in the Northeast or the upper Midwest where they were exposed and then went back home, and that's where they got diagnosed. Can I have the next slide? So here in Wisconsin, there is heterogeneity in the distribution of the disease. So this disease tends to center in the center of the state, and what you can see there, your county right there in the middle of the state has some of the highest levels of Lyme disease incidence in the state. Yay for you guys. And then you can see as you move kind of down into the southeast portion of the state, as you get to the Illinois border, the incidence density of Lyme goes down, but it doesn't go to zero. And it's important to note that when people have gone out and actually sampled ticks, which are the insects that transmit the Lyme bacteria, we can pretty much find the Lyme bacteria in all of the ticks that transmit this bacteria throughout the state. But the ticks in this region, and as you move to the northwest portion of the state, have the highest prevalence of the bacteria. Can I have the next slide, please? So one of the common questions that comes up is, I've been exposed to a tick or I found a tick, and one of the first things we ask in our clinic is what kind of tick, because not all ticks are able to transmit Lyme disease, and I want to make that very clear. Just because you've been exposed to, say, a dog tick doesn't mean you're going to get Lyme disease. Dog ticks don't transmit Lyme bacteria. The Lyme bacteria, or what's more scientifically referred to as Borrelia burgdorferi, is transmitted by that tick up at the top, which is sometimes referred to as the black-leg tick, or the deer tick, or the white-tailed mouse tick. And the way you recognize these ticks is they tend to be the smallest of all the different types of ticks that we encounter. They have a very dark, almost black head and body near the head. and then they have a lighter shell around it. The dog tick that we commonly encounter in other parts of this state kind of have the reverse pattern. They're lighter near the head and darker out towards the outside of the tick, as you can see down at the bottom there. And then the other tick that you may hear about is a Lone Star tick, which we actually don't have much in Wisconsin, but it's reported a lot, is that tick right in the middle, which is called the Lone Star tick. And so the deer tick, or the blackleg tick, is really the only tick that can transmit this bacteria. And then that figure on the right shows the geographic distribution of this tick. And again, the Northeast and the upper Midwest have a lot of infestation with this tick. Interestingly to note, the Southeast also has this tick, but not in the density that we see in the Northeast and in the upper Midwest. The Lone Star tick is the predominant or the dominant tick in that region of the country, and that's why we don't see Lyme disease occurring in that part of the country, because the deer tick just can't compete well with the Lone Star tick. Can I have the next slide? So when you look at kind of when is the risk for Lyme disease highest, and I think most of you probably know this, is the late spring, early summer months are the highest risk period for Lyme disease. And that's because of the life cycle of this tick. So the tick goes through a couple of phases. It goes through, after it hatches from an egg, it's called a nymph. And the nymph will feed on small animals, birds and rodents. And that nymph then can become infectious as it picks up the bacterium from those birds and small rodents. And when it accidentally feeds on a large mammal, like human beings, it can transmit the infection. Now, the nymph at this stage is extremely small. It's really kind of smaller than the head of a pencil. And that's why it's so effective at transmitting infection at this stage, because most people don't even see the tick because it's so small. If it's allowed to grow, it will essentially continue to mature throughout the remainder of the season, and actually goes through the next season where it will mature into an adult, and it will take another blood meal as a fully formed adult before hatching eggs. And that typically doesn't occur until the late summer, early fall period. And that's why we see Lyme disease tend to start to taper off, because when the adult form of the tick is feeding, it's actually easier for people to see it. So the tick gets removed quicker before it can transmit. So, and that's reflected when you look at what is the month where you see the disease most frequently. It tends to start to jump up really high in May, June, and July, and then starts to taper off after that. But we can see people present with disease all the way until October to November, basically until we start seeing snowfall. Can I have the next slide? So let's talk a little bit about what is Lyme disease. So basically what happens with this is when the tick bites, the bacterium that is typically sitting in its gut makes its way to the salivary gland of the insect, and as the organism is feeding on the blood, it is transmitting the bacterium through its salivary gland. It actually takes about 72 hours of attachment for the bacterium to be effectively transmitted to whatever is being fed on. So just because you've had a tick, if you recognize it within 2 to 3 days and successfully remove it, the likelihood that you're going to acquire Lyme disease becomes substantially lower. So the tick does need to be adherent for a long period of time before it can effectively transmit the bacteria. If that happens, many people will develop an inflammatory reaction at the tick bite site. And this is kind of the prototypical rash. What we call erythema migrans is the classic. You might hear it sometimes abbreviated to the EM rash. And this can classically be described as almost a targetoid rash. So there'll be this large area of redness with an area of central clearing inside of it. But the rash can be quite variable, and many people will never develop the rash. Some studies suggests about 80% of people bitten and successfully acquire the infection will develop the rash, but in my experience it's been lower, somewhere around 50 or 60%. Associated with the rash, many people will develop almost a flu-like illness. They'll have muscle aches, fevers, headaches, and just feel pretty bad. If it's not recognized quickly, the bacterium starts to disseminate through the body, and they may often get multiple lesions, very similar to the one that they got at the location of the tick bite site. And so they'll see these multiple targetoid lesions throughout their body. The bacterium invades nerve tissue and heart tissue very well, as well as joint tissue. So in these late disseminated phases, patients may often present with arthritis that's pretty severe in the large joints, typically hip, knees, elbows, and shoulders are common joints to be involved. They may develop facial droops because they get cranial nerve palsies. So somebody coming in with a rash and a cranial nerve palsy or a facial droop that's an acute onset, that's very prototypical or classic for a Lyme disease presentation. And occasionally patients can get cardiac rhythm disturbances because of the invasion of the electrical system to the heart from this bacteria. It actually can cause what we call heart block, where signals from the upper chamber of the heart don't make their way down to the lower chamber of the heart. Now, in this stage, as long as antibiotic therapy is initiated appropriately, most people make a complete recovery without any residual deficits. Unfortunately, in a small percentage of people, they don't get recognized appropriately, and then they can go into late disseminated or a chronic active phase of infection. And in that phase, they can have a lot of problems with cognition. They can have large, persistent problems with inflammation in their joints. At that phase, it's usually just a single joint involved rather than multiple joints involved like we see in the early phase. And once you get into this stage, the resolution with antibiotic therapy becomes much less likely. And I'll talk a little bit more about some of the protein manifestations of chronic disease when I come back. And I just want to slip into the next slide and make sure I'm at the right juncture here. Okay, so I'm going to take a break, and I'm going to give Dr. Steininger the stage.
One thing I forgot to announce is we started at 7 sharp and we want to end at 8:30 sharp. We recognize that's about all people can sit and listen and absorb. So the presenters have been informed they'll have about 50 minutes total for the presentations, and then we'll open it up to questions. Okay?
All righty. So I'm going to cover the controversial parts so you guys can throw tomatoes. Thank you for all coming. This is great. We've packed this place out. It's wonderful. But we'll slide into that slowly. First of all, the incidence of Lyme in Wisconsin is fairly great. We're the sixth highest, have the sixth highest incident in the country. The other 5 states that are above us are all New England states. This is all information from the CDC. The incidence in Wisconsin, so it's cases per 100,000 population, back in 2003 was 13.5. And in 2011, the reported cases were 42.2, so it's gone up threefold in, 8 years. The CDC claims that only probably about 10% of the patients that are diagnosed with Lyme are being reported. So actually that would make it about 420 people per 100,000 population of the total population of Wisconsin each year getting Lyme. So it's fairly prevalent. Transmission, as he said, it takes about 72 hours for the tick to transmit it. The reason for that is that these little nymphs, which are the size of a poppy seed or less, they actually have intestines, probably not like us, but they have intestines and salivary glands, and that the spirochetes, or the Lyme's bacteria, live in the midgut. And they actually had graduate students figure this out, I think. An infected nymph will have about 500 of these little bugs in their midgut. So when they first attach to you, they don't transmit it because it gets transmitted by the saliva. So the tick attaches to you, starts sucking your blood, the blood mixes with these bacteria, and apparently that's what gets the bacteria to start replicating. And they double their size, or double their number every 4 hours. So at 16 hours, there's about 8,000 in there. And that's when they start moving over and infecting the salivary glands, and that's when they could be transmitted to you. So isn't that kind of interesting to actually have somebody figure that out? Better than me.
From what I have experienced, it's kind of been a different story. I was first diagnosed with Lyme disease about a year ago, and I then, after diagnosis, I started on appropriate antibiotic therapy, and my health has just kind of continued to decline for the past year or so, and it's been very frustrating. But first of all, I just want to get across kind of what a Lyme patient goes through on a daily basis. A lot of people think that they have a lot of fatigue and joint issues and a lot of muscle pain and aches, but that's really the least of the symptoms. My main symptoms that I have right now are mostly neurological, and I have a lot of memory issues and cognitive issues as well, and it's been very frustrating to get across trying to explain my symptoms because it's at times I don't even know how to explain them. But how it all started off 4 years ago, I got sick initially, and I went to the doctor and had a standard Lyme test done, and it came back negative. So I kind of took Lyme out of the equation. But as the years went on, I kind of continued to have digestive issues, joint pain, muscle pain, and I knew something wasn't right. And then I was at school out in Utah for 2 years. I'm a big snowboarder, but and I started feeling a lot more severe symptoms. It started with some crippling anxiety, and I was having panic attacks, heart palpitations, and I was taken to the emergency room a couple times, only to find out that they were panic attacks. But still, I was feeling these physical symptoms, and I knew that it wasn't in my head. I knew that there was something more to this. And I called my parents and I said, I have to come home because I'm not well. And when I came home in the fall, I was finally diagnosed with the IGeneX Western blot test for Lyme disease. And then we started treatment from there. But it's just been a roller coaster ride, and I know that it's controversial to some whether chronic Lyme disease exists or not. But in my opinion, what's controversial is the treatment program, treatment process. And it's been frustrating because I've been doing all the right things, what I thought so far as eating right, taking the appropriate antibiotic therapy, and just doing everything I can to get back on my feet. And another thing that kind of bothers me is that I look healthy. I'm on my feet, I'm pretty active, but when people look at me, they think I'm coming around. But really, it's just been a real struggle. And I want people to know, not for me, but for them, that this is a really tough disease, and it's been really frustrating. So